This is kind of funny because it quite literally is the opposite. When people ask me what foods I'm allergic to, I just tell them the foods I'm not allergic to because it's so much simpler. There are only 9.
So this person is suffering from a rare condition called mast cell activation syndrome, and as a part of Rare Disease Day, I want to talk more about this and raise awareness about MCAS. So your mast cells are an important part of your immune system because they help protect you against specific infections such as parasites. They also help clean up your body if you have venom from bee stings or mosquito bites, and they do help with wound regeneration, but they can go haywire and release a lot of chemicals inappropriately. Millions of people actually suffer from a form of abnormal mast cell activation called allergies. So when you have allergies to things like pollen and you sneeze and have a runny nose, that's actually an abnormal immune response that can be classified as abnormal mast cell activation. But mast cell activation syndrome, or MCAS, is something completely different. This is different because in MCAS, your body's mast cells are firing off all over the place, typically 2 or more organ systems at a time, to seemingly benign stimuli. Like this person in the previous video is having severe symptoms to all sorts of foods and can only tolerate 9 foods. A lot of the symptoms of long COVID actually overlap that of mast cell activation syndrome because it's believed that many people who have long COVID have abnormal mast cell activation as well. But there are all sorts of different types of symptoms such as brain fog, fatigue, flushing of the skin, bloating, upset stomach, joint pain, weakness. It often has some overlap with hypermobility syndromes as well, or POTS. People can be very sick with this condition and often are on disability because these flare-up of symptoms can happen at any point and it can be very hard to work. A major challenge with MCAS is the fact that the current testing that we have available is not very accurate. We basically have a blood test called tryptase, we have some 24-hour urinary collection methods, and a couple of other blood tests to look at for other related mast cell disorders such as mastocytosis. Treatment is highly individualized because people respond differently to these treatments, but the first form of treatment is to try to find the triggers that make these symptoms worse and reducing exposure or avoiding them completely, and taking various medications that may help stabilize the mast cell or block some of the chemicals that are released from the mast cell. And in some people, they may be able to take a biologic called omalizumab that may help as well. There's so much that we know and don't know about mast cell activation syndrome, and one video that's under 3 minutes is not going to do it enough justice. So if you have further questions, leave it in the comments section. I'll try to make more videos in the future, and feel free to follow to learn more information.